Start at 9, the paid minute. One is there, start.
Good morning, everyone. Topic for today is disorders of thought, and I'm moderated as Dr. Pali ma'am. First, we'll be starting with introduction, types of thinking, classification of disorders of thinking, disorders of stream of thought, disorders of possession of thought, disorders of content of thought, and disorders of form of thought. Thinking is defined as a mental activity and the processes used to imagine, evaluate, forecast, plan, create, and build. Types of thinking. There are 3 types of thinking: undirected fantasy thinking, which is also known as autistic or deistic thinking. They are largely egocentric. Imaginative thinking, it does not go beyond the rational and the possible. Rational thinking or conceptual thinking, it attempts to solve a problem. Thought disorder. Thought disorder is any disturbance of thinking that affects language, communication, or thought content, and it is inconsistent with person's education, intelligence, or cultural background. Now we'll be starting with classification of disorders of thinking. These are disorders of stream of thought, disorders of possession of thought, disorders of content of thought, and disorders of form of thought. In stream of thought, it is divided into 2, disorders of thought tempo and disorders of continuity of thinking. In disorders of thought tempo, it is further divided into flight of ideas, inhibition of slowing of thinking, circumstantiality, and disorders of continuity of thinking. We have perseveration and thought blocking. Now, disorders of thought tempo, we'll be starting with flight of ideas. Here, thoughts follow each other rapidly, and there is no general direction of thinking. And the connection between successive thoughts, they appear due to chance factor. Example is when a manic patient who comes to OPD, if we ask him how did he reach here, he would say, yesterday I had my flight. Suppose I had my flight yesterday. Flight was of Jet Airway. Jet Airway had an air hostess. Air hostess name was Sapna. Sapna is the name of friend's wife. This is typical of mania. Thoughts will be coming rapidly. It can also be seen in patients with, in individuals with schizophrenia when they are too excited, and in organic states like in lesions of hypothalamus. Now, ordered flight of ideas, they are seen in patients of hypomania. Here, the patient, the speed of thought is not as fast, but the patient will be returning to the task in hand. Suppose we ask the question, they will say the thoughts will be rapid, but they will return to the question asked. Inhibition or slowing of thinking. Here, train of thought is slowed down. The number of ideas and the mental images that present themselves is decreased. They will have difficulty in making decisions. There is lack of concentration and loss of clarity of thinking. Here, this is seen in manic stupor and depression. Sometimes it is mistaken diagnosis as dementia. In circumstantiality, here the thought proceeds very slowly with many unnecessary and trivial details, but finally the point is reached. The goal is never completely lost, and thinking proceeds towards it by intricate and convoluted paths. This disorder is seen in personality trait, and occasionally it can be associated with epilepsy. Example is, suppose you ask a patient, how did he reach at the clinic? Then he would start with, he woke up at 7 a.m. What did he do? Then he brushed his teeth, yoga. He'll put all the unnecessary detail. Then he would say, I reached your clinic at 11 a.m. It is also seen in obsessional personality trait as well as in schizophrenia and schizoaffective disorder. Disorders of continuity of thinking. We'll start with perseveration. Here there is a repetition of same response to different stimuli. As in, the person will say the same verbal response to different question. Suppose you ask a patient, what is your name? He will say Ravi. Where have you come from? He would again say Ravi. He would say the same, suppose you ask, what are you doing here? He would say the same verbal response to different question. It is seen in organic mental disorder and in schizophrenia. Thought blocking is, there is a sudden arrest of train of thought, leaving a patient blank. This is seen in schizophrenia and in patients who are exhausted and in anxious patients also. Disorders of possession of thought. Here, obsession. This is persistent and recurrent idea, thought, or impulse that cannot be eliminated from consciousness by logic or reasoning, and they are involuntary and ego distorting. And obsessional impulses may be impulses to touch, count, or arrange objects. Compulsion is uncontrollable, repetitive, and unwanted urge to perform an act, and it serves as a defense against unacceptable ideas and desires. And if you don't perform it, it leads to anxiety. So, for example is obsessional fear of contamination leads to compulsive washing. And obsession occurs in obsessional state, in depression, schizophrenia, organic state. And compulsions can also be seen in post-encephalitic Parkinsonism. Now, thought alienation. Here, patient has experiences that his thoughts are under the control of an outside agency, or that others are participating in his thinking. Thought insertion is, thoughts are being inserted into his mind by other people or force. Thought deprivation is, thoughts suddenly disappear and withdrawn from his mind by foreign influence. Thought broadcasting. Patient will feel that his thoughts are projected into the environment and everyone else is thinking in unison with him. He will feel that his thoughts are escaping from the mind and people have access to that thought. Seen in schizophrenia. Disorders of content of thought. We'll be starting with delusion. Delusion is false belief that is firmly held despite objective and contradictory proof or evidence, and despite the fact that other members of the culture do not share the belief. True delusions are the result of primary delusion experience that cannot be deduced from any other morbid phenomena. Delusion-like idea is secondary and it can be derived from some other morbid psychological phenomena. Example, in acute polymorphic psychotic disorder. Overvalued ideas are false or unreasonable belief or ideas. It is sustained beyond the bounds of reason. Patients have little or no insight. Example is the distorted body images of the body dysmorphic disorder that exemplify overvalued ideas. Primary delusion. In this, a new meaning arises in connection with some other psychological event, and it occurs suddenly out of the blue. There are three forms of primary delusion experience. One is delusion mood. Patient has knowledge that there's something going on around him that concerns him, but he does not know what it is. Delusion perception. This is attribution of a new meaning, usually in the sense of self-reference, to a normally perceived object. If the patient says that they are of royal descent because they remember that the spoon they used as a child had a crown on it, this is a delusion perception because there is the memory and also the delusion significance. And it is a diagnostic of schizophrenia. And delusion perception should not be confused with delusion misinterpretation. For example, a patient with delusion of persecution, he hears the stairs creak and knows there is a detective spying on him. This is not a delusion perception, but a delusion misinterpretation. Sudden delusion idea. Here, delusion appears fully formed in the patient's mind. This is also sometimes known as autochthonous delusion. For example, if the patient says that they are of royal descent because they were taken to a military parade as a small child, and he says the king saluted them, then this is a sudden delusion idea because the delusion is contained within the memory and there is no two-memberedness. In two-memberedness, there is a link from the perceived object to the subject's perception of this object and a second link to the new significance of this perception. Secondary delusion, it arises from some other morbid experience. And this can be seen secondary to depressive mood and hallucination. or in psychogenic or stress reaction that can give rise to psychotic states of delusion. Content of delusion. Content of delusion include delusion of persecution, delusion of infidelity, delusion of love, grandiose delusion, delusion of ill health, delusion of guilt, nihilistic delusion, and delusion of poverty. Here, delusion of persecution, patient will believe that they are being attacked, harassed, cheated, or conspired against. In delusion of reference, the patient knows that people are talking about him, slandering him, or spying on him. And some patients also believe that they or the loved ones are about to be killed or being tortured. In delusion of infidelity, this is also known as delusion of jealousy, but it is a misnomer, as patients tend to have morbid jealousy with delusion of infidelity rather than delusion of jealousy. They occur in both organic and functional disorder. Often the patient has been suspicious, sensitive, and mildly jealous before the onset of illness. And delusion of infidelity is also seen in affective psychosis, where they may even represent a morbid exacerbation of a pre-morbid, mildly jealous attitude. Delusion of love. It is also known as fantasy lover syndrome or erotomania. Here, the patient is convinced that some person is in love with them, although the alleged lover may have never spoken to them. Occasionally, the isolated delusion of this kind are found in abnormal personality states. Grandiose delusion. This is exaggerated concept of one's importance, power, knowledge, or identity. Here, the patient will believe that they are God or the Queen or a famous rock star. It is commonly seen in manic psychosis. Here, the patient may report hearing voices of God and saint, confirming the elevated status. Delusion of ill health. Here, it is characteristic feature of depressive illness, but can also be seen in schizophrenia. Depressive delusion of ill health may involve the patient's spouse and children. Here, the patient may believe that they have a serious disease like cancer, and the depressed mother may believe that she has infected her children, and children have inherited incurable insanity. This is delusion of guilt, seen in severe depressive illness. The patient believes that they are bad or an evil person, and they may have committed a sin or insist that they will rot in hell for this. And delusion of guilt may also give rise to delusion of persecution. Nihilistic delusion. Here, the patient will deny the existence of the body, their mind, their loved ones, and the world around them. They may assert that they have no mind, no intelligence, or the body or part of body do not exist, that they believe they are dead, the world has stopped, or everyone else is dead. It is seen in severe agitated depression and also seen in schizophrenia and states of delirium. Delusion of poverty. Here, one is or will be without material possession. They will believe that destitution is facing them and the family. This is typical of depression, but can also become steadily, but it is less common now. Disorders of form of thinking, also called formal thought disorder. Thinking characterized by loosened association, illogical construct, thought processes disorder. Loosening of association, speed disturbances involving a disorder in logical progression of thoughts, manifested as failure to communicate verbally adequately, unrelated and unconnected ideas shift from one subject to another. Suppose a patient comes to the clinic and a doctor asks, "How are you feeling today?" He won't answer that. Instead, he would say, anything. Your clinic is very nice. Dogs are barking. Flowers are blooming. In this, individual parts are not connected to each other. Seen in schizophrenia. Tangentiality. Here, the disturbance in which the person replies to a question in an oblique, digressive, or even irrelevant manner, and the central idea is not communicated. Suppose a patient comes to the clinic and doctor asks, "What is your home address?" He would reply, he would start with, suppose, home. So I bought a home of 1 crore. Now the value is 2 crore. And then he would deviate that I'll be going for shopping now. I'll be doing this. Here the patient will start from one word related, but will never return back. Thank you. So in ordered flight of ideas, the patient will return to the task in hand. But in flight of ideas, it is by chance. Suppose he has related it that he had a flight yesterday, then the flight was of Jet Airways. So there was an air hostess whose name was Sapna. Then Sapna is the name of friend's wife. Is like it is a he's just remembering thoughts in a very rapid way, and it is by chance the name of air hostess is Sapna, and Sapna is the name of his friend's wife. But in ordered flight of ideas, speed is not that fast.
How many of you have read this topic before? Me, who has read first year, second year, some of you have read. Okay. How much time have you devoted to this seminar?
I started 1 week before, and I would do whenever I would get time.
You have given 1 week to the seminar. The most important seminar in psychiatry. Why not taking a reference of SIMS? See, the whole idea of academics is when it is not taken up. If you are coming to your guides and co-guides a week before. Seminars कब announce हो जाएगा officially? So if that is a problem for the person in which one of the seminar is just because we are taking the schedule and this kind of an important when it is before, and I don't think so how many academics individually they are coming to the residence. How many academics you have? Every month, how many academics you have? Usually, good. So I think for first year when you have such a less frequency of academics, you're supposed to give more time and input, and specifically your first presentation. Your seniors, I suppose, their first presentation, and then you need to, because it is difficult to understand these concepts in 1 week, grabbing everything, putting in the presentation can be difficult. So specifically, it was announced long before. So I don't think so. Be a seminar. So case conference, you will probably need 3 or 4 days, maximum a week, because if you are lucky enough to have that case. For journal clubs, I don't think so. We need more than a week. For seminars, you have to at least do 4 weeks. First, you need time to read everything, assimilate the concepts, then putting into a PPT format or in handout. It needs a lot of time and being interesting. So this appears to be because it is a first presentation, it is an attempt which, as per her, she would have tried hard. But it doesn't leave you with sense of completeness. See, this much of a thing like reading a chapter, I don't think so. We all need to come here and read it. We all know how to read English. So you have to, it is advisable. This is an opportunity for your other colleagues also. You have to start preparing in academics, see for multiple sources, because and then assimilate the information, then put it in PPT. Otherwise, because I was happy with the example, so I was anticipating every slide you will give an example. So every obsession also, I think you gave an example. Then last me, you give an example of formal thought, right? But in flight of ideas, clang associations, various types of clang associations are not there. And when you go to other forms of perseveration, various specific varieties of perseveration, few things which I came across. Formal thought is in itself is a big section, so and difficult to understand. So you could have coordinated with your guide. Okay, formal thought I'll be present in a different seminar. I'll take off formal thought. I'll present everything else. How to differentiate one phenomenon with another phenomenon. Good that you have come with examples, but all of you should have read. And Sims has given a lot of concepts little differently. So that could have been referred. So like delusion perception, सबको समझ में आ गया होगा suppose. What is delusion perception? How you differentiate it with misinterpretation? So another example of delusion perception, not this one. So I'm having paranoid schizophrenia. Driving a car, I go to the, I'm waiting in the red light, and red light appears to be more glaring, not shifting at times. So you can light changing with the what way. I straight away think this is happening because this red color I'll associate with aliens and aliens and aliens. That is what. So it will be delusion perception. Anyone? रेड कलर था, रेड लाइट कलर, फिर उसने उसको एक मीनिंग दिया, परसेप्शन हो गया. वेरी गुड. तो जो हमने एग्जांपल दिया वो तो एक तरीके से मिसइंटरप्रिटेशन हुआ. कोई उसका डिल्यूजन वर्क में उसने प्रोसेस यूज किया, देन डिल्यूजन वुड एक्सटेंड. तो ऑलरेडी पेशेंट इज सफरिंग फ्रॉम फ्रॉम स्किज़ोफ्रेनिया. प्राइमरी डिल्यूजन मतलब de novo, to start de novo. If this kind of a thing starts first experience, मैं red light पे खड़ा था, red light पे. Before this event, there was no abnormal or morbid. same thing will be termed as delusion perception. So delete that crown line. Crown line delete कर दो. वो that is a fallacy. You read German text यहाँ से लिया गया था. So there they explain कि delusion memories होती है and delusion memories में ही delusion perception होता है. और उसका एक example. What fish did is fish would deleted all those 3-4 paragraphs. वहाँ से वो example उठा के डालते. So what residents of new trains would think कि delusion perception can be only diagnosed with delusion memories. ऐसा नहीं है. So this is a classical miss error of that copy paste. Which fish did. Landing into all sorts of things. And then we only remember one example because we are not understood. अब हम एक example याद रखते हैं जो हमको समझ नहीं है उसी को put. All right.
So you have been asked to record fish.
Hmm?
So you have been asked to record the fish.
Who has asked to put fish is a primary source. And then there are other sources like sense with which will help you to understand better. तो ऐसा नहीं है कि आपको सिर्फ एक ही सोर्स करना है. That is a primary source. That is the most important version of it. But if your understanding is not extending, you have to go to other sources. That is a minimum required, mandatory source. बाकी चीजें भी आपको पढ़नी है ताकि आपका प्रेजेंटेशन और मीनिंगफुल बने. बहुत सारी चीजें उसको नहीं दी तो आपको और भी पढ़नी पड़ेगी. That is why you have to guide. See that what is the use of having a guide or a moderator for a presentation? Don't know. We delete all the moderators. Every presentation you have a moderator and all this responsibility lies with the moderator कि कौन सा resource करना है कौन सा source नहीं करना है. Okay? तो delusion perception करना है. अगर डॉक्टर मंत्रन तो एक मेनियक पेशेंट दौड़ रहा है उसको एक स्टोन मिलता है उसको लगता है अरे ये तो स्टोन की कर्वेचर appears to be a curvature of a god. उसको लगता है मैं आई एम एन हनुमान अवतार. तो अचानक से I think it's a grandeur meaning to it. So what is the phenomena? Same person running and the same person has same phenomena but no prior morbid process. So then there are two connections: the percept, delusion meaning to the percept. You should know to quote other examples. अगर आपको और examples नहीं आ रहे मतलब आपको समझ नहीं आया. I still remember to decode this I took 6-7 months. You should read fish something. Yeah. Everyone used to put the same example. Then we went to the German text from where this was around. Then सबसे समझ में आया कि नहीं, this is what we read in fish is in this section is rubbish because उसने वहां से वो सब उठा के डाल दिया जो समझ में नहीं आया. तो आपको समझ में नहीं आया तो आप बोलो समझ में नहीं आया. तो वो हमारा काम है कि हम लोग पढ़ के समझाएंगे या हम अपनी नॉलेज जितनी भी है लिमिट उसे समझाएंगे. लर्निंग स्टेज यू शुड नॉट इम्बाइब व्हाटएवर इज बीइंग सर्व्ड एट यू. नहीं समझ आ रही है. ठीक है. एनी अदर क्वेश्चंस? delusion like idea समझ में नहीं आ सका. So delusion like ideas, is it similar to certain delusion ideas? To the prior slide. हाँ ये पीछे वाला. So this epiphany is primary delusions are divided into three types: delusional mood, Go to the next slide. Visual perception. Next slide. And third guy, sudden delusional idea. तो sudden delusion idea. जिसमें अचानक से delusion idea बना. So it is similar. Concept is same as delusion perception. Here de novo बने. I am God first. No percept nothing. One day I was sitting for meditation and I felt that I own this earth. But अगर same चीज in context of mania होती है कुछ होता है, then it becomes delusion like that. You are preceded by morbid states. Come to the next slide. And the sudden delusion idea is actually you can categorize it into serenity. क्यों? दो तो कनेक्शन हो गए. एग्जाम्पल दिया, एक परसेप्ट हो गया, परसेप्ट का मीनिंग हो गया, पत्थर है और पत्थर से मीनिंग है. उसके पहले कोई मॉर्बिड क्वेश्चन. सिंपल. ठीक है, वो क्राउन छोड़ दो. क्राउन इज द मोस्ट रबिश थिंग. When I go to exam, if some degree quotes me crown example, I मुझे समझना था कि नहीं समझना है. Example should be native context. आप जो real encounters कर रहे हो उसके example होने चाहिए. और मुकेश बता. ठीक है. And simple things. वही चीज बहुत complex हो रही है तो मत उस पे मतलब नहीं समझना. और कुछ
never and was trying to create because the discussion of the deep of love, the personality beyond the reach of that. And before the neighbor, like things you will even it's a normal that happens normally.
delusion क्यों बोले?
Wanted to marry him, wanted to run away because he was taking the time to understand. Make her understand that this is not possible. He is married with a
There was a real relationship with अगर वो वहां की तरफ से नहीं था then there the controversy. कोरोबरेटी नहीं कर पाओगे तो एस्टेब्लिश पॉलिसिटी कैसे कर पाओगे? अगर रियल रिलेशनशिप था तो चांसेस कम. रिलेशनशिप उस तरफ से नहीं था तो आई थिंक डिल्यूजन का सीन आ गया था. वो चलता है. So what do you want to see a real delusion of erotomania, delusion of love is a patient comes to the OPD. Every time she comes and then whosoever is there, I actually tell them. Mostly interns रहते हैं उस समय कि she is in love with a person who is known as Milan. She was admitted with us here and paliperidone डिपो में चल रही है. The delusion is still very much there, and she indirectly tells, asks me now what should I do. Was couple of times she went to Delhi and created ruckus. He is married, having kids and all. He is not at all interested. He took some legal action against her. Now the whole catch point is that only which she believes known as Vilvira. So she associates or join or all these dots she is joining that this is something which is defined. No? Any other questions? Any other questions? और हाँ बताओ दूसरी क्वेश्चन एंड डिरेलमेंट है ना एंड इनिशियल एंड सर्कमस्टेंशियल चारों चारों बताओ
In loosening of association, a patient would suppose you ask him one question. He won't start with that topic, but he will say everything around whatever. He would say anything, but the topics are not connected to each other. And in tangentiality, he may or may not start from that word. Suppose you ask, how have you reached the, what time have you, suppose in this example only, we ask, what is your home address? With, he would start with the word home, one word he would start and then he would deviate, but he would never return to that place.
tangentiality is always in context of question answer loosening is in context of whole interview so loosening is not he when he starts and then the question the answer is related somewhat related somewhat tangent to the question asked and then but not exactly pointing it to but it can happen ki it starts with tangentiality and subsequently the whole sample is ugly. So tangentialities are losing will सकते हैं, ठीक है but derailment as per Nancy Andreessen is controversial derailment and loosening are little different क्या है
So somewhere it's written loosening and derailment of same.
हम छोड़ दीजिए बस क्या explanation आएगा
That the thoughts are in derailment, content of thoughts, they move off the track slowly, and they never return to the questions asked.
कौन से phenomena return आ जाता they return to the
Circumstantiality, and
Like?
even in prolixity of order of ideas, there in hypomania where it is seen, they return to the point.
Flight में नहीं आते हैं
Flight may, the ideas are very fast, but
flight में goal पे आते हैं
most of the people
revolving around the bush में तो circumstantiality
in circumstantiality, thoughts are very slow. And in flight, reaction time is increased, so they speak very fast and they do not return to the point.
Circumstantial classically we've seen OCD or OCPD patient will come and then when you try to rush them off they'll take your time नहीं सर अभी तुम आया ही नहीं अभी तो अभी कल टेल मी अबाउट लास्ट 6 months no so the half an hour or 1 hour they'll clearly tell you each and every situation so they are pedantic very frivolous very detailed observation so loosening when they reach the goal
So in loosening, they do not reach.
so loosening they do not reach
Yes, sir.
derailment they do not
They
reach
do not reach.
tangentiality is
Tangentiality.
different context.
Yes.
Tangentiality is different flight they do not reach ordered flight they might
They,
on flight में we don't say they reach to the goal we say there is no determining tendency so goal attainment becomes very difficult समझ में आया so loosening वाला समझ में आ गया associations are superfluous so that is why they say loosening then whole sample will not give you a coherent meaning out of this in derailment the associations are less superfluous than what you have in loosening that is why the patients will derail that means you can make some meaning of the sample but they will go away from the goal जैसे ट्रेन की पटरी होता है वो शिफ्ट करती जाती है व्हाट इज नाइट स्मोक थिंकिंग नाइट स्मोक थिंकिंग क्या होती है पढ़ लेना है दैट इज व्हाई only reading fish is a difficult
I
but
don't
that
understand.
doesn't mean कि fish नहीं पढ़ना है fish is the this a bible kind of a thing but सिर्फ fish पढ़कर आप understanding नहीं build up कर सकते you need to have parallel readings What is asynthetic thinking? Flight of ideas में था. Concrete thinking. कहते ना abstract ability is concrete. वो किसने दिया था? Formula for disorder में concrete thinking concept किसने दिया था? Mytolins क्या होते हैं? Mytolins क्या होते हैं? तो ये सब चीजें important है. Flight में तो I think Dr. Shelley you can have another seminar. They can read it from McKenna's speech. And give it to Dr. Asta or some senior. They will be prepared accordingly. Because if you don't read McKenna's speech, you will not develop a concept of formal cortisol. You must read book. Detailed verbatims are given of the patient. Very subtle form of formal cortisol. You might not get schizophrenia. जब आपको hallucination मिलेगा delusion मिलेगा. So the art of diagnosing is schizophrenia presenting a very subtle form. When you pick up this probably schizophrenia. Start antipsychotics where people won't start. So that kind of phenotype you'll only catch if you are expertise in this formal material. Dr. Rupali, you can take comments from Dr. Shah.
Pictures, figures, images, animations, सब के लिए अच्छा होता है. Definitely, books से बहुत नहीं. Fish since मैं इसके बाद वीडियोस नासा के आते हैं अच्छा सब लोग कहते हैं इसमें से ज़्यादा कोई बात नहीं फर्स्ट टाइम राइट दैट इज इम्पोर्टेंट. अगली बात
Rupali. That is right. See, a day before presentation आप दिखाते हो ना, it demotivates the moderator. तो लगता है कि अब तो कल तो है ही, अब ठीक है जैसे भी present. That was a little disinterest. So what also is important that we don't want to be harsh on whatever she has tried her level best, whatever is in her capacity. But this is being pointed so that your colleague, your batchmates, Dr. Abhijit, Dr. Mankaran, they put more efforts. As a group, you raise the standard, match the standards of the seniors because their presentation was to compare with them, and then they are there to help you out so that and prepare presentation, lock it a week before so that we can re-revise, we can revisit those within a week. Always record a presentation on Zoom, listen to it by yourself. कि अच्छा मैं ऐसा बोल रहा हूँ मैं बोल रही हूँ. What present improvement might take up, what pronunciations, what connotations, where to emphasize, where not to emphasize, modulations. So उससे आप you become a good speaker. सबसे. Thank you. We start the rounds. Website क्या है? List बनाइए. Can you give this new register? The signing भी किया. Please करवाओ. ठीक है.
ये कॉपी से आगे
आज में.
20